Welcome to History, Chief Complaint, and History of Present Illness. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Let's start off with 3 quick questions. Let's start off the history with a chief complaint. The chief complaint is the medically necessary reason for seeking medical attention. If someone were to ask you, what brings you to the office today, then they are asking for the chief complaint. It is important for you to organize your chief complaint or complaints so that they can be written in 5 or 6 words or less. The chief complaint is not the details of why you are seeking medical care, it's just the topics. If you are being seen for the care of a new problem, then the chief complaint will introduce it. Sore throat, sinus pressure, high blood sugar level are all good examples. If you had an opportunity to write your own chief complaint, you would not want to write, I think I have a sinus infection, because the tiny display in the EHR might only display, I think I have a, and cut it off. You could write sinus infection, question mark. If you see a medical provider for a preventive wellness visit, then the chief complaint could be wellness visit. If you are going to the doctor for a procedure, such as the removal of a mole, then mole removal is a fine chief complaint. Sometimes it's hard to summarize why you are seeking medical attention. You may offer terribly tired as your chief complaint, and that's okay. You should not offer here for a follow-up, or to see the doctor as a chief complaint. These descriptions do not justify medical necessity and may result in your care being rejected for payment. Following the chief complaint comes the history of present illness. The HBI is the who, what, when, and where of health record documentation. Location, where on the body. Quality, how does it look or feel? Severity, measurement with a number. For example, you could rate your pain or stiffness on a scale from 0 to 10. Duration, how long has it been occurring? Timing, when does the problem occur? Context, that's circumstances, like what were you doing when it happened? Modifying factors, what makes it better or worse? Associated signs or symptoms, these are additional complaints. So let's complete a chief complaint and HPI as an example for left elbow pain. Location, left elbow. Quality, throbbing pain. Severity, pain 6/10. Duration, 1 week. Timing, constant pain. Context, fell in the ice in the park. Modifying factors, better with ice and ibuprofen, hurts to move. Associated signs and symptoms, I broke the same elbow 3 years ago doing the same thing. It's like a journalist asking who, what, where, and when. When these objective concerns are entered into the health record, it will look like this. CC for chief complaint, then left elbow pain, then HPI for history of present illness, left elbow pain, constant throbbing pain, 6/10, past week, fell on the ice at the park, better with ibuprofen, hurts to move, I broke the same elbow 3 years ago doing the same thing. That's pretty nice. This kind of documentation detail will help everyone on your healthcare team hear and understand your concerns. If you have a chronic condition or are following up on a concern, you do not need to retell the story every time. If someone has diabetes, for example, the patient does not need to retell the story of how the disease was discovered. Rather than complete a history of present illness, this patient would offer a status of chronic disease or condition. And I'll show you how to do that in the next module. Considering responses for history of present illness is not hard. It is hard, however, to do in the office or hospital if you have not thought about the questions in advance. Rapid-fire questions by health staff may catch you off guard. Now that you know the questions, try to reflect a little to remember the details. It is important that these details are documented in your health record. It will help your medical provider at the encounter, and it will help anyone else who looks back at your visit. There's a saying in the medical billing and coding world that if it isn't documented, that it didn't happen. It's common sense to have your problems or concerns described and documented in your health record with enough detail so that you can be heard and hopefully understood. How long has this been going on? That's duration. What makes it better or worse? That's modifying factors. It's just a matter of some lingo. With a little practice, you will be able to represent yourself in the manner that medical providers are taught to seek information. I am confident that as the details of your history clearly show what you're experiencing, you will be better understood and better treated. Thank you for participating in this module. Please answer these quick questions. I'll see you at the next module.